Hi, my name is Josie Spar, and this is my final video presentation on occupational therapy-based interventions for those living with postural orthostatic tachycardia syndrome, or also known as POTS. POTS is a disorder of the entire autonomic nervous system that affects the body's ability to regulate functions such as heart rate and blood pressure. When someone with POTS stands up, their heart rate skyrockets abnormally, often causing symptoms like nausea, fatigue, brain fog, exercise intolerance, dizziness, and sometimes even fainting. These symptoms make everyday activities extremely difficult, even small things such as showering, cooking, working, things that we tend to take for granted. While treatments tend to focus on masking symptoms with medicine, I wanted to personally explore whether occupational therapy could actually improve a person's ability to function in everyday life, completing those tasks such as showering and self-care and cooking. The purpose of my capstone was to determine whether occupational therapy-based interventions improve activity tolerance and participation in meaningful daily activities for individuals living with POTS. This project used a secondary research or a scoping review approach. Now, instead of collecting my own data, I decided to analyze existing research studies. I used databases such as PubMed and Google Scholar and used search terms such as POTS and occupational therapy, OT interventions for POTS, and things like that. My initial search identified 18 articles. After applying inclusion and exclusion criteria, I narrowed my literature selection down to 8 articles and ultimately selected 4 of those 8 for a more detailed analysis. To compare the studies, I organized the information into a large table that included the study population, the intervention type, objective measures, subjective measures, and overall outcomes. This allowed me to identify patterns rather than focusing on each study individually. For my results, several consistent findings emerged across all 4 studies. The first major finding was improved activity tolerance, which was one of the main things that my research question was trying to identify. Participants demonstrated a greater ability to complete activities of daily living, perform functional tasks, and participate in meaningful occupations. Although the interventions differed across each study reported improvements in physical endurance and participation. The second major finding was improved symptom management, which is usually everybody's main concern, is reducing symptoms. So, participants experienced reductions in fatigue and brain fog while also becoming more aware of their symptom triggers, which means that once they are aware of those triggers, they can stay away from them, which means they will have less flare-ups. Occupational therapy interventions taught practical strategies such as pacing activities, modifying tasks, and using cognitive strategies to better manage symptoms throughout the entire day. Now, the third major finding was improved quality of life. Participants consistently reported greater confidence, increased independence, and improved participation in work, school, self-care, and social outings. Rather than simply reducing symptoms or masking them, occupational therapy helps people return to the activities that actually mattered most to them before they started going through POTS. Another important finding was that most of the successful interventions shared a lot of the same characteristics. First, they were all individualized, meaning treatment was tailored to each patient's symptoms, goals, and daily routines, which in my opinion is the most impactful because everybody's different. Everybody lives their life differently. Everybody's symptoms can be different. So it's definitely important to take each person into consideration and not view each patient as a whole. Like not view all of the patients together as one. Second, they emphasized gradual progression through activity pacing, energy conservation, and graded activity programs rather than pushing patients too hard, too fast. Finally, all of the interventions maintained a more functional/holistic focus, emphasizing participation in meaningful daily occupations instead of simply just treating symptoms. After reviewing the literature, one conclusion became the most evident. While exercise and rehab can certainly improve cardiovascular function, occupational therapy takes it one step further by translating those improvements into everyday life. Rather than asking whether a patient's heart rate has improved, occupational therapists go in deeper and ask questions like, can you shower more efficiently now? Can you actually stand up and prepare your meals for 20 to 30 minutes straight at a time? Can you do everything you're supposed to be doing while you're at work? Can you even participate in daily life, small things like that, doing things that you enjoy doing? That functional perspective is what makes occupational therapy unique and special, especially to those with POTS. However, my research also identified a lot of limitations. There are very few OT-specific studies involving individuals with POTS, so many studies have small sample sizes, and there is little long-term follow-up. Additionally, there is no standardized protocol for OTs that they can follow to treat people with POTS. And I think once a more standardized protocol is developed, treating POTS will be a lot easier and more common, because right now there are not a lot of treatments for POTS. There's not one go-to treatment that people can rely on. So these gaps demonstrate the need for additional research to better establish evidence-based guidelines for OT interventions. In conclusion, the evidence reviewed throughout this project suggests that occupational therapy-based interventions can actually improve activity tolerance, symptom management, participation in meaningful activities, and overall quality of life for individuals with POTS. The interventions that produced the most consistent outcomes were individualized, gradually progressed, and focused on improving everyday function rather than just simply reducing symptoms. The biggest takeaway from my project is that living with POTS is not just about managing symptoms. It's about helping people regain the ability to live their lives how they want to live them. Thank you for your time, and I look forward to diving deeper into this topic at the next capstone.